Hi, everyone, and thanks for coming to my talk. So we're going to talk about the basic things about the foot and the ankle. And when I was asked to give this talk, it's kind of a really broad topic. There's a lot of different kinds of conditions and things that can affect the foot and affect the way you walk. And so what I hope to do is just kind of give you a general overview of some of the main causes of foot and ankle pain, and also to kind of talk about how we approach treating these types of problems. Just for a quick introduction of who I am, the reason why I have this slide is not to promote myself, but to have you guys understand that when you do see a doctor, you want to make sure that you know how their training is and what kind of credentials they have, because it varies a lot. When you look at this x-ray, just as something to see, this is actually an x-ray of a ballet dancer who's on point. And you can see the kind of stress that it can give on the foot and the ankle, the joints, and even the muscles and the tendons. And so some people come in, and it's not always as obvious as this, but if you look at this, you can see this is an example or an x-ray of someone wearing high heels, and you can see it's not too unsimilar to a ballet dancer on point. And so sometimes the diagnosis is pretty obvious, and a lot of the shoe wear we have nowadays can lead to some of the problems that we see in the foot and the ankle. So basically, the overview of my short presentation is going to be to give you guys kind of a basic anatomy of the foot and the ankle, and then talk about a couple of common reasons why people come in to see me. Why does my heel hurt? And then the other topic is why does my ankle hurt? And we'll talk briefly about ankle sprains and ankle arthritis. One of my mentors always told his patients, if you want to forget your problems, wear tight shoes. And we do know that foot and ankle problems can be pretty debilitating a lot of times, because it affects the way people walk, it affects their activities of daily living. And so it's important to get it addressed if you're having trouble. And just a shameless plug, I'm part of Torrance Orthopedic Sports Medicine Group, and it's probably the oldest and longest running orthopedic practice in the South Bay, and in my biased opinion, it's the best. We have all our specialties covered: spine, sports, hand, foot and ankle, and so we feel like we provide a good service. And so just, you have this information if any of you guys ever need to see someone. We have specialties in each field of orthopedics. So why the foot and the ankle? Well, everyone always asks me why I went into foot and ankle. They say, why do you want to be around those stinky feet all day? Or some of my hand colleagues call the foot the dumb hand because it's just something you step on. But the foot actually is, it's an amazing structure that sort of developed into this platform that we can walk on, and we can walk on for years and years and years without, most of the time, having too much trouble. If you take like the average amount of steps a person takes a day, it's roughly about 7,500 steps. And as you can see here, if you measure it a normal stride over the course of an 80-year lifetime, that's about 110,000 miles. And if you equate it in a general sense, you can walk around the world 5 times. And so the foot has to be a good, nice, stable platform in order to do this. And it's pretty amazing that it can. Every day you're taking these kind of steps and putting pressure on your foot. And so again, why the foot and the ankle? When I was training in New York City, I visited the Natural History Museum, and there they have this really cool exhibit of how the foot kind of developed. And whether you believe in evolution or you believe in creation, the point is that there are a lot of similarities to the way the hand is structured and the way the foot is. The problem is there's differences. The hand is made to grasp things, and the foot is made to be stable in order to walk on. And so this is just kind of a background to what you'll see as some of the problems that we see in the foot and the ankle. So there's 2 important concepts, and these we think may be atavistic traits, but they happen in the foot. And an atavistic trait means, as you guys probably know, it's kind of like a progress towards an ancestral trait. So whether or not, again, you believe in that, what we see are a couple things. One, we see something called first-ray hypermobility, and the other thing is calf muscle tightness. And these are probably the 2 leading common causes of a lot of different problems in the foot and the ankle. So if you look at this first picture, what you can see here on this picture, you can see this big bump right here. And that's actually the first metatarsal bone, and it's there because there's a joint below it that is a little looser than it should be, and that's called first-ray hypermobility. This problem that you see, it's called a hallux valgus deformity or a bunion deformity, and that's the kind of the common term. And then calf muscle tightness, and we'll talk about that and its implications in terms of the ankle and the Achilles and so forth. So again, first-ray hypermobility, the point of this is that the hand and the foot have a lot of similarities, but the key difference is the hand needs to grasp things. So this joint right here in the hand, if you look at the bottom of the slide, it's called the first carpal metacarpal joint, and it's what allows the thumb to... Thank you very much and have a good day. So again, this joint needs to be mobile in order for the hand to grasp things and for us to be able to utilize tools. Well, in the foot, the analogous joint is called the first tarsometatarsal joint, and the name's not important, but its job is to be stable and to support the arch when you put weight on it. And so that's where thank you. So that's where the similarities differ. And the problems occur in the foot when that joint, the analogous joint, is a little too flexible than it should be, hypermobile. And so that leads to different problems like we talked about, like bunions or hallux valgus deformities. And you can see this is an x-ray of a normal foot, and you see all these metatarsal bones are pretty well aligned. If you look on the bottom, this is an x-ray of someone with a bunion or a hypermobile joint. And what you can see, it allows this bone to kind of drift out to the side. And so first-ray hypermobility, this is the cause of things like bunions. But not only bunions, the other things that this problem can cause are things like stress fractures and metatarsal overload. Because this bone is shifted out in a position that it shouldn't be, these other lesser metatarsal bones get more pressure, and they can get stress and stress fractures and things like that. It can cause hammer toes, and it's also an integral part in people, especially adults with flat foot deformities, and we touch upon that later. So the point is not to know all this stuff, but the point is to understand that there is a specific problem in the foot that we do see and can be corrected, and it's called first-ray hypermobility. The second major cause of problems, mostly around the ankle, but also in the hind foot, is calf muscle tightness. And again, we're not talking about evolution or creation or anything like that, but in order to walk on all four limbs, the calf muscle in the rear feet need to be tight in order to maintain that kind of crouched position. Interestingly, in 2005, they discovered this family from Turkey who some of the family members could only walk on all four limbs. And the point of this is not whether or not this is an atavistic trait or whether this is an evolutionary thing. The point of this is that all these people had really tight calf muscles, and it's necessary in order to walk on all four limbs. So when we walk on 2 feet, our Achilles tendon and our calf muscle, they need to be stretched out in order to maintain an upright position. And so we see a lot of problems coming from the calf muscle being too tight. And why does that happen? Well, there's a couple reasons. One, if you look at this normal side, the calf muscle here, if it's stretched out, the foot takes a normal distributed pressure and stress when you walk. When it's too tight, as a simplistic way, you get increased stress in certain areas, and that is what leads to problems. And not only that, when the calf muscle is tight, the calf muscle and the Achilles tendon, they're like rubber bands. And so if you hold a rubber band stretched out for a long period of time, then eventually something's going to happen. It's either going to wear out, it's going to snap, something like that. So calf muscle tightness, and a lot of our therapy and treatment is aimed towards stretching that out. And this is just a small list of some of the things that can be caused by calf muscle tightness. And the nice thing is once we do know that the primary cause of a lot of these different problems is a tight calf muscle, sometimes the treatment is as simple as getting your calf muscle stretched out. And so we'll talk about that when we talk about some of the other problems. So moving on in terms of more common problems that we see, we'll talk about 4, and I see heel pain a lot in my office, and I see a lot of patients with this problem. And to understand why my heel hurts, you kind of have to understand the anatomy of it. And part of the problem is the calf muscle. And so if you look at this picture on the right, your calf muscle is here, and when it's tight, it comes down and forms your Achilles tendon like this. And so the Achilles tendon becomes tight. When you have, if you look at this anatomy, the Achilles tendon comes down and it attaches to the heel bone here. And then the next thing along the course of this chain is something called the plantar fascia. You may have heard of plantar fasciitis and stuff like that. Well, it's all connected. The calf muscle, the Achilles tendon, and then the plantar fascia ligament, which is a strong ligament on the bottom of the foot that's responsible for helping to hold up your arch. And so the first, or one of the main common reasons people come in when their heel hurts is a diagnosis of something called Achilles tendinosis. And what this is it's kind of like a wear and tear of the Achilles tendon. We talk about holding a rubber band really tight, and eventually something kind of fatigues and fails. Or we see that, and that's what happens when you have a tight calf muscle and it's not allowed to stretch out. You get problems with your Achilles tendon because it's too tight. People typically come in with pain in the back of their heel, and it hurts with walking, it gets worse sometimes with activity. And we get x-rays oftentimes, and people come into the office, and a lot of patients are sort of focused on, yeah, someone told me that I have a bone spur. You need to check out this bone spur, heel spur, because that's the cause of my pain. Well, we see that all the time. This right here, this is a picture of an Achilles tendon bone spur. And historically, a long time ago, surgeons used to see this and say, oh, well, there's a physical problem there, so let's take it out. And so they used to book all these patients for surgery to take out these bone spurs, and people weren't getting better. And so that's how they soon realized, yeah, well, that can't be the problem. And so they discovered the Achilles tendon problem, and they discovered the plantar fascia problem. So for this area, when people talk about bone spurs, it's usually just an incidental finding we see on x-ray that means, yeah, the Achilles tendon is kind of worn out, or the plantar fascia is too stretched and too irritated. So talking about treatment and also kind of prevention, because a lot of these things can prevent you from developing these problems. The normal basic tenets of musculoskeletal treatment are things like resting it, icing it, providing some kind of compression with a brace or some sort of strap. You may have heard of the acronym RICE or PRICE. That's what it stands for, and that holds true for all the different kinds of treatments or conditions that we try to treat. And so understanding what the primary cause of these problems is, which is, again, I keep saying this, but calf muscle tightness, the treatment should be to stretch the calf muscles so the problem goes away. And so our aim initially when people come in is to stretch the calf muscle, and also specific exercises to stretch the Achilles tendon. It's gone so far that a lot of physical therapists and other medical doctors, they research this. And so they've sort of discovered a specific way, they're called eccentric Achilles tendon stretching exercises, that we do and teach in the office and in physical therapy that are proven to help with these kind of problems. So if my Achilles tendon hurts, oftentimes it'll get better with things like stretching. Other things that help, they have this thing called a night splint, which you can see here. And basically what it does is it kind of passively keeps you stretched out when you sleep. And so this provides a stretch while you're sleeping. It's kind of the lazy way of stretching, but it's also an effective treatment for this. And when all else fails, and probably only a small % of people won't get better with these things, there's other options like injections and surgery too. And I'm a surgeon, and so just to let you know what the kind of surgery that we do, this looks really gruesome and severe and significant, but the point of this is not that to show you exactly what's happening, but one of the things we do in surgery when we fix this problem is we surgically lengthen the calf muscle. And that's probably the single most important thing in this scheme of surgical techniques that we do that helps patients. And we see people improve that way. So we know that if functionally and physically we can stretch the calf muscle and people get better, it kind of gives us evidence to show that, yeah, that's probably one of the main causes of the Achilles tendon problem. The other things we do is we clean out the Achilles tendon, and sometimes we transfer another tendon in the area to help reinforce it and to help bring a blood supply to help it heal. And again, this is a long recovery. Most people don't need it, but there is a little bit of a misconception in terms of foot and ankle surgery, and you have to do it for the right reasons. And when you do, when we kind of look at all the studies and look at the results of other orthopedic surgeons that do this procedure, the success rate is probably about 90 to 95%, and that's nationwide across the country in terms of surgeons that do this procedure. So, it's available, but most people don't need this. The second most common cause of heel pain is something called plantar fasciitis, and I see this a lot in my office. And again, here's the same picture. It's the end of the chain of the calf muscle Achilles, and the next thing is the plantar fascia. And its job, it's a ligament that helps to support the arch. And people normally come in with pain in the bottom of their heel. Oftentimes it's worse when you get out of bed in the morning. And again, everyone asks about bone spurs, and here's an x-ray of a heel spur or bone spur, and again, it's not the problem. And so when we treat these, we don't take these bone spurs out because we know usually it's not the cause of the problem. But we do know now that the cause of the problem is the calf muscle. So very similar, the normal tenets of musculoskeletal treatment, resting it, icing it, all that stuff. And then stretching the calf muscle. And then there are specific exercises to stretch the plantar fascia. And so saying stretch your calf muscle, it's a big deal. But this is what makes people better most of the time. Night splints, similar to what we saw before. And then there's also injections in surgery. And so the few percent of people that don't get better with these kind of things, one of the things I want to mention is a special injection that it's not new technology, but it's been out a long time, and it's kind of become the Botox for athletes. You can see a lot of the professional athletes will get this for all different kinds of problems. And it's a promising technology, and we do it, and it seems to work pretty well. And basically what it is, it's an injection where we draw your guys' own blood, and then we spin it down to the growth products and healing factors, and we re-inject that into areas that need help healing. So it's using your own body's healing response to help stimulate a better healing response. And the basic science research and the short-term studies that have come out show that it's pretty effective. For the plantar fascia in particular, the short-term results, when you compare them to like a steroid injection or placebo, seems to be a little bit better. We don't know long-term how it's going to pan out, but short-term it seems to be effective. And the best thing about this, and the thing I like about it, is that it's your own blood, so you're using your own body, and so there's no side effects. There's no adverse reaction from your own blood. So it's an option, and it's something that's there in case people don't get better with surgery. And it's probably only about 5% of people that don't get better with the basic things like stretching and that sort of thing. And again, I am a surgeon, so there is surgery to fix plantar fasciitis, but again, not unless you fail conservative treatment for 6 months or a year, if it's just so bad that you can't take it. Out of 100 people that I see with this problem in the office, maybe less than 5 people need this. But again, it's something to be aware of because there is a misconception in the public in terms of foot and ankle surgery. So again, if you're responsible and you do it for the right reasons and you do it after you've failed, if you fail conservative treatment and the pain's bad enough that it's affecting your everyday life, it's an option. And it's a minimally invasive procedure where we make 2 small incisions and we use a camera and we put it underneath the plantar fascia and we release about 1/3 of it. And what that allows it to do is stretch out because it's too tight, and it fills in with new tissue to allow it to heal. this doesn't stretch out your calf muscles. So either you're going to do that on your own with physical therapy, or we can lengthen it surgically. But again, it's out there, and the results when we poll are probably similar to the Achilles tendon. 90 to 95% people report good to excellent results, even as far as 5 or 10 years after the procedure. So it's out there, but most people won't need it. And this is just a list of some of the other causes of heel pain in that area, and probably about 80% of the time it's going to be an Achilles tendon problem or plantar fascia problem. But there are a certain percent of people that have these other things going on. And so you ask yourself, well, if it's just as simple as stretching, do I need to go see a doctor? Do I need to see a specialist? I think as much as getting a diagnosis of what the problem is, and probably it's going to be plantar fascia or Achilles tendinosis, it's important for them to look to make sure that you're not having something else that is mimicking those symptoms, because the treatment can be different depending on the different things you have. So switching topics, we're going to talk about the ankle a little bit. And to understand the ankle, you kind of need to understand the anatomy of the ankle. And the basic anatomy is that the ankle joint is made up of 3 main bones. It's the fibula bone, that's the outside bone that you can feel on the side of your ankle, the tibia bone, and the talus bone. And as important, in between the bones, there's a thing called articular cartilage, which is the smooth surface that lets the joint kind of glide. And that's probably the most precious commodity that we have in our musculoskeletal system. It's bound by these strong ligaments, and it's also bound by strong tendons and muscles that help secondarily stabilize the ankle joint. So the most common reason why we see patients come in with pain in their ankle is ankle sprains. And ankle sprains are probably the most common ankle injury that we see. And it's estimated that about 1 million per year of people get these kind of ankle injuries. And it usually happens from a supination and rotational type twisting injury. And so ankle sprains are graded 1, 2, 3. And basically, grade 1 means that there's stretching of the ligaments. Grade 2 means that there's partial tearing, and grade 3 means that there's full tears. And there's also another kind called the high ankle sprain, where the ligaments in between the tibia and the fibula bone get disrupted, and a lot of football players get that. And it just means a different kind of ankle sprain. And so like the other treatments, the treatment for ankle sprains are things like resting it, icing it, compressing it, same thing that we see before. A lot of times a short period of immobilization helps, either in a cam boot here or ankle brace like this. And then sometimes physical therapy helps to get your motion back, get your function back, and all that stuff. And so a lot of times we prescribe physical therapy to help with this problem. And typically it takes about 3 to 6 weeks to get better. And most of these also will get better with time and treatment like this. And so why do you need to go see a doctor? Well, it's important to get kind of checked out sometimes. You wouldn't imagine how many patients I see that come in and think they just have an ankle sprain, but end up having a fracture or something like that. And so it's always good to kind of get it checked out, especially when the pain is maybe a little worse than you would expect. Things that don't let this get better are things like ankle instability. If the ligaments get torn and they don't heal tight enough. If scar tissue builds up in the front part of the ankle, sometimes it can cause impingement problems where the tissue pinches and causes inflammation and pain. Tears in the tendons that secondarily stabilize the ankle can sometimes get torn. And then also, and probably most important, are cartilage injuries. And if you look at this MRI, this is an MRI of the ankle joint, as you can see. There's some signal in here, and what that signifies is that when that person had an ankle injury, they developed this defect in the cartilage, or almost like a little pothole in it. This is a arthroscopic picture looking at the talus bone inside the ankle joint, and that's what a cartilage injury or defect looks like. And so it's oftentimes, especially when the symptoms seem bad, important to get evaluated. And not only that, especially if there's situations where there's recurrent injuries, to understand why this is happening. If is it because you're too clumsy or you're off balance, is that why it's happening? There's other reasons that are like risk factors for getting recurrent ankle sprains, like high arches. People with high arches tend to have a more tendency to rolling that or twisting the ankle. Loose ankle, if the ligaments are too loose, it causes the ankle to become unstable. And then some malalignment issues. If you had a previous fracture that didn't heal quite right, or in this case, this kid has a condition called Blount's disease, where the tibia bone, it kind of curves inward. And those are all reasons why people tend to have recurrent ankle sprains or ankle injuries. And so even with those things, if it's not getting better, we always listen to Mother Nature, and we always try to give it as much time as we can, because a lot of times, and most of the time, these kind of things can heal. And the same things, resting it, icing it, bracing and immobilization, and sometimes physical therapy. And also, if it's a couple months and people aren't getting better, then injections, and that injection we talked about, platelet-rich plasma, can sometimes help stimulate things to heal and progress. But if these things don't work, then it's important to get these checked out. And if the conservative treatment fails, there are surgeries, and they're pretty minimally invasive surgeries nowadays that can help fix these problems that prevent people from developing problems in the future. So for example, if your ankle joint is too loose because the ligaments didn't heal, there's a procedure to tighten up the ligaments. Ankle arthroscopy, where we use a little camera to fix different problems, that kind of has revolutionized treatment for these kind of issues, because through small incisions we can do things like clean up scar tissue. And in this picture you can see that same cartilage defect. What we do to fix this is we clean up the bad cartilage and then poke holes into the bone to help stimulate blood flow, and that allows this area to heal in. And that can be done with just 2 small incisions. And so these options are out there if you don't get better and you are one of those few people that are having continued trouble. And then if you have problems with your alignment, there's ways to shift the bones around to realign your foot in a better position. And if any of the tendons are torn, that's pretty easy. You can surgically repair these. But again, once you get to the point where you have an ankle sprain, you do all the conservative treatment and it's not getting better, then sometimes these are good options, because what we want to try to prevent is from developing arthritis. And you guys have probably had some talks on arthritis in the knee and the hip. Well, it's not too unsimilar. We know that arthritis is probably the leading cause of disability in the United States. And so we do everything we can to try to prevent you from developing an ankle that looks like this, where it looks like the bones are rubbing. So basically, ankle arthritis means wearing of the cartilage. It can cause a stiff, swollen, and painful joint, and it can lead in the ankle to progressive deformity. And what's different between the ankle and the hip and the knee is that the main cause of it is not usually just wear and tear degenerative. It usually happens because of some sort of trauma. So if you've had an ankle fracture in the past, or if you had a bad ankle sprain that never healed or was treated, that's what leads to arthritis in the ankle. Other things like instability in the ankle, or if your foot is too flat or too high, it can cause abnormal stresses on the ankle that leads to early wear of the cartilage. And other things like inflammatory conditions like rheumatoid arthritis can cause these things, and infection, of course, if your ankle joint gets infected. Just so you can see what it looks like, this is a real picture of the inside of an ankle joint, and what you see up here, that's normal white, good quality cartilage that, again, it lets the ankle joint kind of glide smoothly, like an ice rink, kind of. And when you have arthritis, it's pretty clear. It's just wearing of the cartilage. And this kind of beigeish looking stuff, that's bone. So that's the bone underneath the cartilage. And so we want to try to avoid people getting this, which is why all the other things are really important. And even if you do develop this, there are good treatment options that aren't surgical. And one is activity modification, and that means not pounding on your ankle. So if you're able to run marathons, maybe shift over to swimming or changing to biking or something like that. Correcting the primary problem. So if your foot's too high or too flat and it's leading to cartilage wear, something as simple as getting the right kind of orthotic to balance your foot out better, the right kind of brace to hold your ankle stable. These are all things that really help people and are really no risk, and there's really no downside to trying these if you're having trouble. Physical therapy to strengthen the ligaments and strengthen the muscles around the ankle to help support the ankle is also pretty important. And then other things like taking anti-inflammatories and things like that, or having an injection, that can also help somewhat. And so if all else fails, again, there are surgical options to treat this problem, and we'll just briefly talk about 3 and then we'll end the talk. And again, here's an example of a bad ankle joint with arthritis in it. And the 3 options when you have ankle arthritis that doesn't get better with conservative treatment are things like an ankle arthroscopy, ankle arthrodesis, which means fusing the ankle, and ankle replacement surgery, which we'll talk about in a second. So again, mentioning ankle arthroscopy, it's a small procedure where we use 2 small incisions. We use a camera to visualize the ankle joint, and we basically use these special instruments to clean up the ankle joint. The nice thing about this procedure is that the recovery is short, the risks of the surgery are small because it is pretty minimally invasive. The problem with this in treating bad ankle arthritis is that the longevity of the treatment is a little bit questionable. So it probably will help you, but does that mean it's going to help you for 3 months or 3 years or 5 years? That's a little unpredictable. So it is always an option, but maybe not the greatest option for really bad ankle arthritis. The historic treatment for bad ankle arthritis is something called an ankle fusion, and it seems really crazy that we're basically sticking the ankle joint together and making it form into one bone. And the nice thing is it's been around a long time and it's been well studied, and patients report good relief from something like this. You know, when your ankle's this bad in terms of arthritis, the ankle's pretty stiff. So stiff anyway, but it's painful. So if you take away that pain, people function really well. You can walk normally usually. If you have the ankle fused in the right position, people can pretty much do most of the things they like to do, except maybe wear high heels or do yoga or something like that. But it still is a pretty good procedure in the worst case scenarios when people don't get better. The new and exciting technology, and it's not new, the ankle replacement surgery has been around for decades. Historically, it hasn't had the greatest results, but probably over the last 5 to 10 years, other foot and ankle surgeons like myself have sort of are at least starting to perfect the technique, and we're trying to catch up to our joint colleagues, like the hip replacements and the knee replacements, and they're getting better. This particular device was released probably about 2 years ago, and this is the one I use, and the technique for putting it in is really good and reproducible, and patients are reporting really good outcomes with this. The thing we worry about with any kind of ankle replacement or any replacement is that these can wear out. And so in a young person, putting something like this in, knowing that they may have to come for a second procedure at some other time, it's kind of questionable because we don't know if this is going to last 10 years or 20 years, but it's getting better. And so if we can avoid people having ankle arthritis or try to prevent that, we should. But we're getting better in terms of our techniques for treating this problem, this debilitating problem. So in summary, the thing I guess I want you guys to take out from this talk is the foot and ankle is pretty complicated, and there's thousands of different problems that occur in and around the foot and the ankle. And the important thing when you're seeing a doctor is to identify what the problem is. And it's probably going to be one of the more common things, but you need to get a good diagnosis in order to treat your problem properly and treat it well so it doesn't come back. The other important thing is most of these conditions, as long as you get the right diagnosis, can be treated with these different kinds of non-surgical things. So and also prevented. So like stretching your calf muscle, that's going to prevent you from developing problems with the Achilles tendon. Getting the right kind of shoe wear to better align your foot when you walk is oftentimes helpful. And then there's injections and things like that to help. And then when all else fails, again, the misconception is there's foot and ankle surgery is bad, but it's actually really good if you do it for the right reasons and you do it correctly and you do it for the right indications and for the right patient. And so that's my talk. And just a little side note, we do know as specialists that one of our biggest problems in the office is waiting time. And we hate that patients wait. And it's never because we don't respect your time or we're out drinking coffee or playing golf. It's usually because we have complicated patients that we see as specialists. And so maybe the 2 or 3 patients before you have complicated issues that require a long amount of time to help treat them and diagnose it. And so when I'm in the office, I try to give every patient the amount of time they need to get on the right treatment program. And for you and for the patient before you and the patient after you, that's what we try to provide is good quality care. And sometimes it means the patient that's the last in the clinic and on the list has to wait a while. But again, we always apologize, and it's never because of anything bad. We just want to make sure we're doing a good job taking care of you guys. And I think that's it. I don't know if you guys have this, but there's this is a list of good web resources. So if you have any questions about like foot and ankle conditions or you have trouble, these are reputable websites that you can go to that will kind of help explain things for you. So thank you.
Just to talk about plantar fasciitis briefly again. It's pretty rare that people come in with plantar fasciitis on both sides at the same time, although some people come in with it 1 year on one side and on the other, some other time on the other side. So it can cause other problems. If the plantar fascia is torn a lot, and again, the job of the plantar fascia is to hold up the arch, and so if it's compromised, it can cause your foot to get flatter. It can cause the way the foot distributes the pressure when you walk to be altered. And so it can affect other. The most common reason why it affects other parts of your foot when you have plantar fasciitis is because whether you're thinking about it or not, you're kind of transferring your weight in different positions in the way you normally walk to kind of avoid the pain you're having from the plantar fascia. But that usually gets better once you treat the plantar fasciitis. There are all kinds of different kinds of arch supports and straps and balls and different kinds of things you can do to help support the plantar fascia when you're having pain and you're having trouble. There's a lot of commercially available things, but again, the best thing to do is get your calf muscle stretched out. That's probably the most fundamental reason why, or most fundamental treatment is stretching everything out so the problem goes away. And it's also a way to help prevent it from coming back, because once your calf muscle's stretched out and the pain goes away, then you don't have to worry about it coming back because you don't have a tight calf muscle anymore. What I find works the best is if you get one of those 16-ounce plastic water bottles and you freeze it, rolling on that seems to be a good thing. One, because it massages the foot and the plantar fascia, but it also provides ice because it's cold. And so again, like we saw in the slides, those are kind of the two primary tenets of musculoskeletal treatment is resting it, icing it, and then massage also seems to help. Basically, you probably have seen people stretch their calf muscle against the wall where they're pushing, and then you have one leg straight in the back. That's a good one. And then just even something like getting a towel and sitting down and kind of pulling up on your ankle up this way to get it to stretch. You can feel, anytime you stretch your calf muscle, you can feel it in the back there. Those things are good. And a lot of times there's other ways to do it. And we talked about those special techniques that the therapist teaches, the eccentric stretching exercises. And if you can't kind of figure out, and the internet has a lot of good resources in terms of pictures on how to stretch, but if you can't, maybe go to a few sessions of physical therapy, and they can spend an hour with you showing you all the different ways to stress. What I went through to be trained, I went to undergraduate school, I went to medical school to become a doctor, so I understand how the body works, I understand the physiology of the human body really well. And then I get trained in orthopedic surgery, so that not only is foot and ankle surgery, but it's spine, hand, joints, all different kinds of things. So what that allows me to have is kind of like a broader idea of how each thing is kind of interconnected, how the foot and ankle is connected to problems in the knee. If sometimes people come in with pain in their ankle and it's coming from their back. And so I think the training, it's different. Podiatrists, I know, do not go to medical school, so they're not medical doctors. So the other thing that I think that's important when we talk about this question is when we like to provide treatment options, especially when it comes to things like surgery, we like to have a good foundation or good backing in terms of, okay, you need this surgery because of this reason. And the reason why I think it's good for you is because this has been studied by doctors and orthopedic surgeons across the country for years and years and years, and they've published good articles and good studies to show this is an effective treatment for this kind of problem. And that's the way we train, and that's the way we learn when we become medical doctors for treatment. That's the way we learn when we go through our orthopedic surgery residency. And I don't know if that's not there in podiatry training, but that's how I approach these kind of problems. There's so many different kinds of shoes nowadays that it's not the same for each person. Everyone has a different kind of foot, shape, alignment, and so it's important. I tell my patients to, when they're choosing shoes, to go to the store and try on a bunch of different ones, and whatever's most comfortable is probably the best. It's interesting. We look at shoe wear and we look at like the popularity of different kinds of things, and in the 60s, the popular thing was to wear shoes with good arches. That's how Nike became so popular. And so the fad was, you gotta have shoes that have great arches. And then you can see over time, now we're talking about these 5-finger shoes or minimalist shoes, because now we think that maybe not having that kind of support helps people. And so when you see these kind of things change and you don't see any rise or decline in foot and ankle issues, it kind of means that we really don't know. And so some of the things that they do look at, for example, they look at these tribes in India or in Mexico where these people grow up not wearing any shoes. And it's interesting because the incident of foot and ankle problems in these specific isolated tribes is a lot less than the United States. So not saying that shoe wear causes a lot of problems in the United States, but there's something to be said about that. There's a great book, it's called Born to Run, and they track this ultra marathon running tribe in somewhere in Mexico. And these guys, they run barefoot all the time, and they don't have a lot of foot and ankle problems. And the point now is, yeah, minimalist shoes may be okay, and maybe there's some trend when we study these different societies that not having a good arch support may or may not be better. But the point is that we all have been wearing shoes our whole lives, and so to change that abruptly now, it can lead to other problems. So if you're wanting to try something like that, the thing I encourage patients to do is really kind of progress into it slowly and not just one day have a good arch support shoe and go running in a minimalist or a 5-finger shoe the next day, because that's going to cause different stresses on the foot and that's going to cause other problems. It may be more of a function of the soft tissues. Over time, as you wear and you walk on your feet, things tend to get swollen, your circulation gets less good. There's a whole circulatory system called your lymphatic system, which, if that's over time, is a little bit worn out from being used for 80 or 90 years. It can cause more swelling in the foot, and we see that as maybe the reason why feet seemingly get bigger. If you have a progressive deformity, like your foot becomes flatter over time, things like that, that can give you the impression of a bigger foot. But when we actually see these, and we want to answer these questions correctly for people that ask, because everyone asks, if you x-ray people who say they have their feet are growing as the years go on, and you compare them to x-rays from like 20 years past, when you measure the actual bones, it's not really any different. So calluses and corns, they're not too unsimilar. Basically what those words mean is that the skin thickens, and so you have a thickening, a place where the skin's thickened. And why do those happen? And it's usually because there's some sort of pressure being placed on the skin underneath it. So we see that in people who have bunions, because their second metatarsal bone is taking too much pressure, and so on the bottom you see these calluses. So it's a skin's reaction to increased pressure. And so the reaction to a skin, what the skin does is it thickens to protect whatever's underneath that, causing pain and problems. So the treatment, again, and that's why it's important to understand what's the cause of these things. And even for something as simple as a callus, what's the cause of the callus? Is it because you had a fracture and now your bone's healed different and it's causing too much pressure? Is it because you just walk a lot and now your bone is getting used more? So it's important to identify that, because you can treat that problem. And then the callus itself, which is a secondary effect, can be treated with shaving it down and things like that. And numbness in the foot or tingling and that sort of thing, it can come from, again, a lot of different problems. The most common thing is something called peripheral neuropathy. And what that is where the nerves that run down to your feet and run down to your hands, they get a little disrupted over time, and so they either become overactive or underactive, and they can cause this kind of tingly sensation. And you see these commercials on TV with these like blue men like kind of jumping around the feet and the toes, and that's kind of, sometimes people feel like that's what it feels like. And so there's a laundry list of different reasons why people have neuropathy, and it can be something like diabetes, which is a common cause. But really the most common cause of neuropathy in aging people is something called idiopathic, which means we don't know why that happened. And it happens. But the good thing is the treatment is going to be the same. So obviously if you have diabetes, you need to treat the diabetes to help the neuropathy. But the neuropathy sensations itself, there's different kind of medications that you can give. Sometimes you can give injections in a certain way. And I always feel like, because there's so many nerves running down the foot and the ankle, sometimes people can get neuropathy feelings because the nerves in their foot are irritated. And so figuring out why those nerves are irritated, is it because your alignment is off? Those are important things to check, because it may be something simple, and not always, is getting an orthotic that supports your foot in the right position. Or we see people come in with cramping and nerve type symptoms, and sometimes that means your calf muscle's tight. And so figuring that out's important. And then orthotics, physical therapy, things like that, medications are all kind of things that we use to help people who are having trouble with neuropathy. I think someone mentioned neuromas, and people probably have heard of Morton's neuroma, or neuroma in the third web space.
I have it, in fact.
Okay, so it's not too unsimilar. If you have a neuroma that's overactive and it's on both sides, it can cause this kind of tingly kind of feeling similar to neuropathy. So it's good to check out. And basically what that is, it's an area where two nerves come together, and the signal for the nerve gets a little jumbled up like a traffic jam. And so nerves don't like to be jumbled up like that, and so they become inflamed and irritated, and they can send signals and shooting pains and things like that when they're irritated. And for those kind of treatments, there's special pads you can wear to help with that. injections again, and there's also surgery to fix this, but most people don't need it, and medications do. Bunions are caused because that joint is too loose, and so historically there's probably been 100 different procedures described to fix a bunion, and most of those are aimed at cutting that straight bone and kind of curving it over to take away that bump. And we know now that fixing the bunion means to correct that loose joint and to put the bone in a better position. And so one, I think if you're going to do bunion surgery, it should be for the right reasons. Number one, it should be painful enough that it's affecting your everyday activities and causing pain on a day-to-day basis that you can't live with. Because the surgical procedure is good, but the recovery time, there's no such thing, and there's a lot of advertisements about laser treatment, about quick fix surgery, in and out on the next day, and those may work sometimes, and some people do okay, but you don't want to roll the dice with something like that, because if it fails, probably some of the saddest cases I see are, and not to be sexist, but young women in their 20s who have a little bit of a bump and need it fixed, and so they find a surgeon to fix it for cosmetic reasons, and they get it fixed, and now your foot's altered. And if it doesn't work right, then they can't walk because it changes the whole biomechanics of how the foot works. And so they come into me, and it's after this has been done, and I can fix it, but it makes it a lot more complicated. And so bunion surgery historically has been kind of trivialized a little bit, but it's a big deal. So it's a good procedure if you have a lot of problems and you want someone who can do it the right way for you. But if you can't, there's a lot of things like orthotics or strapping. They make a lot of good bunion cushions and toe spacers, different kinds of devices that you can use to help kind of protect the bunion. Sometimes we inject the bunion with cortisone to help make it feel better. And these are the kind of things we like to try when someone comes in and it's not that bad. And a bunion being bad is not based on how it looks or what the x-ray shows. The bunion being bad is based on how a patient feels. So I've seen patients come in with, like, you look at their foot and you're wondering, gosh, how do you walk? Because their bunion is so bad, and we take an x-ray and it looks like the worst bunion I've ever seen because that bone's so tilted out, but they're fine. But then again, you see these other patients that come in with just a little bit of a deformity, but they can't walk and they're miserable. So again, it's important to understand, one, what the symptoms are, two, to make sure you're doing these kind of things and treatment for the right reasons, and never treat the x-ray, what the x-ray looks like or what the foot looks like. All these kind of treatments have to be based on what you're feeling. And so if your bunion is hurting a lot and affecting your everyday life, then it's sometimes not unreasonable to fix it with surgery. Stretching, as we talked about in the talk, I think is probably the most important thing you can do to help prevent things from happening. And that doesn't it's not just because of for the Achilles or for foot problems, but everything, stretching your shoulders, stretching your back, all that stuff. I think, and I see patients with all different kinds of problems get better with things like stretching, and it's important. Personally, I'm really stiff. All my muscles are tight. I was a college athlete, but I never really stretched. And so over the past probably 1 year, roughly, I started doing yoga to stretch. And just from personal experience and seeing my other patients, makes a huge difference. And I think yoga is great. I think it gets everything stretched out. And physical therapy is great also. But the nice thing about yoga is that you can stretch and do things while your mind is kind of focused on different things. So it's not like a therapist telling you, okay, stretch your calf muscle now and do this, this, this. It's like, okay, let's learn this certain pose. And so it kind of takes your mind away from the stretching aspect of it, but you get stretched out. And there are a subset of connective tissue disorders that causes your joints and your body to be too loose. And those patients do have problems. They can develop problems with their ankles. They can, from recurrent ankle sprains, problems with their shoulders. And so if you're Yes, and those are hereditary sometimes. And people inherit tight calf muscles sometimes too. So I think there is a hereditary component, but probably about 3 to 6 months, because a lot of people get better that way. I tend not to operate on anyone who doesn't try that first, unless there's some other reason or compelling reason to do it, like it's just so severe that they just want it fixed. But you need to try conservative treatment, and that can be 3 months, 6 months. My cutoff is, you don't want to torture yourself. So after about 6 months is usually my cutoff to say, okay, well, you can either continue on with what you're doing, because chances are over time it will get better, or if you're fed up and you want this fixed, then like we talked about, there's a good surgical procedure to fix it, but only if for the right reasons, and only if the pain warrants that. A lot of times those problems are because of some abnormal stress, and I know you're going to probably think I'm some sort of weird guy that only thinks about calf muscles, but a lot of that comes from the calf muscle being tight. Again, the instep oftentimes is associated with the plantar fascia, because the plantar fascia, it attaches and connects the instep. And then forefoot problems, problem in the toes, problems in the front part of your foot happen, as we saw that slide, because the foot takes abnormal pressure. And so when you're walking up and down stairs, or you're walking up and down hills, that even creates a more stressful situation for the foot, especially if your calf muscle is tight. And again, there's 100 other different reasons for that kind of pain, but probably the most common is that. Fat pad syndrome is a condition where the heel, or the bottom of your heel, which has that squishy fat pad, it's fat. And some people think that heel pain comes from that fat pad being inflamed or irritated. Sometimes it can come because that fat pad kind of wears out over time, and so now your foot or your heel is walking on the more like the bone itself and the skin, and so that can increase pressure. A fibroma means that the fibrous tissue that makes up the ligaments, it grows more than it should, and so it usually forms like a ball. This typically happens in the bottom of the foot, and it typically happens with the plantar fascia. The fascia is the plantar fascia, it's the fibroma, and plantar fibromas are common in the foot. Some people have it in the hand, and it's called Dupuytren's contractures, where they develop these lumps and bumps in their hand. So it's a benign thing because it's not a cancerous thing, and it's not going to spread over your body. But a lot of times these are treated because they feel a bump on their foot, and the problem with treating these surgically is that the recurrence rate is probably about 50%. So most of the time it doesn't bother people, and people come in and they just want to get it checked out and see, hey, this is that, and so I have nothing to worry about. But other times we make orthotics that can accommodate, or shoe inserts that can accommodate the bump. Benign fibroma in the ankle, don't really see too much. What we do see in the as lumps and bumps around the ankle joint itself are things called like ganglion cysts, which are basically like a outpouching or a little bump that's basically like a fluid-filled sac, and that's probably the most common bump that we see in the foot. But again, in the ankle area and the foot area, but they're benign. Dystonia means that the muscles lose their ability to function properly, so they get a little lazy. And yeah, it can affect the foot a lot, because in order to walk and in order for your foot to be maintain its arch and be supported in all these walking steps that you make, the muscles have to be activated. The bones play a role in terms of the structural stability of the foot, but the soft tissues like the muscles and the ligaments, they provide the secondary stabilization for the ankle and the foot. And so if you have dystonia, where the muscles aren't working as well as they should, then it can impact your feet.